I am Dr. Sunil Kumar Kilari, Senior Consultant Nephrologist. I've been practicing nephrology for the past 15 years in Guntur, Andhra Pradesh. Today we discuss about CKD, what causes CKD, and what is meant by pedal edema, and how to prevent this CKD. So first of all, what is CKD? CKD is nothing but slow progressive loss of kidney function over months and years. But how do you define it? It is defined by the presence of kidney damage, usually measured by urinary albumin excretion of 30 milligrams per day, or decreased kidney function that can be detected by checking the eGFR less than 60 ml per minute per 1.73 square meter. If kidney damage or decreased kidney function lasts for 3 or more months, irrespective of the cause, then we can label them as having CKD. So, what do kidneys actually do in our body? How do they help us? Kidneys are mainly excretory organs. So, the main fundamental function is it helps in excretion of water-soluble wastes, both nitrogenous and non-nitrogenous. In addition to that, it also helps in maintaining the body's mineral and electrolyte balance, as well as maintaining the acid-base balance of the blood. Kidneys not only excretory in function, but also helps in some synthetic function also. It produces an hormone like erythropoietin, which helps in the production of red blood cells. So, when the kidneys are damaged, we expect derangement in all these excretory and synthetic functions of the kidney. So, as we see the epidemiology, this CKD is extremely common. As per one estimate, 843 millions of people are having CKD in 2017. Roughly, we can say approximately 1 in 10 have CKD. And it stood among the top 10 causes of death in some countries. So, who are at high risk for CKD? Those who are having diabetes, high blood pressure, heart problems or stroke, obesity, and elderly age, especially more than 60 years, and who smokes and who has family history of kidney problems are at high risk for CKD. Then it's better to screen them at least annually with either urine protein test or serum creatinine test in order to detect the CKD early. So we can stage the CKD in 5 ways. Stage 1 is the first one, where eGFR is more than 90 ml per minute, but with some evidence of kidney damage like proteinuria. Stage 2 is where eGFR is between 60 to 90, that means 60 to 90% of the function will be there, along with the presence of any evidence of kidney damage like protein leak in the urine. Stage 3 is nothing but when the kidney function is reduced by more than 60%. When kidneys are functioning less than 60 ml per minute when the eGFR is less than 60 ml per minute per 1.73 square meter, we can call as stage 3 CKD. When its function declines by more than 70%, I mean when the eGFR is less than 30, if its function is impaired between 50 to 30, we can call it as stage 4. When its GFR is less than 15 ml per minute per 1.73 square meter, then it's called stage 5, where we'll expect life-threatening complications from kidney disease, where we have to prepare these patients for renal replacement therapy like dialysis or kidney transplantation. So how do you know whether anyone has CKD? Many patients may not have any symptoms of CKD unless it reaches the final stages, and CKD stage 5. In early stages, they may not have any symptoms. If anything are there, Some symptoms are there like edema legs, that means swelling of the both the legs, or decrease in urine output, and some shortness of breath, breathlessness, or some people are not having any appetite. Some people will have a nausea and some vomit. Some people notice easy fatigability. Some people pass urine more frequently in the nights. Some have sleep problems. Some have muscle cramps. Some having changes in sensorium. And when you check the BP may be high in some people. So these may be the symptoms in some patients, but symptoms may not be there in some patients until they reach the late stages of CKD. See, you know, pedal edema is one of the main symptoms of CKD, where we have a swelling of the legs. Swelling of the legs sometimes in some other diseases may be only one side, but in CKD it usually causes swelling of the legs on both sides. And when you press it, it will cause indentation, pitting. That's why you call it as pitting edema. And because of the edema, and the skin will be shiny and smooth. These are the features of pedal edema. So exactly what causes this edema in patients with CKD? See, an excessive loss of protein in the urine will decrease the albumin in the blood. That will causes edema. That's one of the very important reason for edema in these patients. Another thing is impaired kidney function. Kidneys helps, it's a mainly excretory organ. It helps in excretion of water soluble substances. So when the kidney functions are impaired, you will expect a decrease in urine output, thereby causing the accumulation of excessive amount of water in the body. That's why we'll get edema in these patients. So when there is an excessive amount of protein leak in urine, there will be a loss of albumin in the blood through the urine. So it will cause decrease in albumin in blood. That produces the edema legs. And because of that, there will be a cholesterol will be high in the blood. And fat substances also will be excreted along with the protein in the urine. So excess protein leak and decreased albumin in the blood, edema legs, and excessive cholesterol in the blood, and leaking of lipids also along with the protein. All these we call it as a nephrotic syndrome. So as you know, edema, pedal edema is the very common symptom of CKD. We should know how to control this edema. See, as you understand, this edema is because of excessive accumulation of water. We have to take measures to, to control that edema. First and foremost thing is, why should it, what is the reason for this underlying edema? First we have to address that cause. What causes this edema? We have to address that. After that, for any patient with edema legs, we have to ask them to cut down the salt intake in their diet. Especially sodium in the diet must be less than 2 grams, salt must be less than 5 grams per day. Say just use a pinch of salt, that's enough. And use a diuretic. These are the medicines that your nephrologist will prescribe in order to pass more urine. If you take a diuretic, you will pass more urine, thereby excessive edema in the body will come down. Excessive water in the body will come down. Apart from that, you can use the compression stockings for both the legs. And moreover, you can ask that patient to keep the legs in elevated position, especially above the heart level. Okay, these are the measures we have to take to control the edema. So finally, you know, CKD is a very common, and 1 in 10 adults will have the CKD, and diabetes and hypertension are the two most important causes of the CKD. And once it sets in, it's very difficult to cure it. You can only slow the progression of CKD. So when anyone has a CKD, they are at high risk for further progression of CKD, and also at high risk for cardiovascular diseases, and they are also high risk for infections, and at the same time they are also at a high risk for death also. So by all means, we have to prevent this CKD by observing the 8 golden rules. First one is you have to keep fit and active by doing regular exercises, yes, at least minimum 45 minutes per day, 5 days a week of walking. Then the second best thing you should observe is keep your sugars under control. Otherwise, you may get a kidney problem if you don't control your sugars properly. And the third thing is check your blood pressure. Keep it under the normal level. Especially keep the blood pressure level less than 130 by 80. And fourth one is eat healthy food and keep your weight in check. Do not go overweight. Control your weight. And the fifth thing is maintain a healthy fluid intake, at least 2 to 3 liters a day, so that kidneys will be protected in the long run. But when you have a pedal edema, you should not take too much of fluid. When you have a pedal edema means you have an excess amount of water, you have to cut down the total fluid intake to the at least 1 liter per day. So if you have a pedal edema, you cut down your fluid intake to 1 liter per day. If you don't have pedal edema and you don't have any edema, then you can take 2 to 3 liters of water. That will be good for your kidneys. And do not smoke. That's very, very important. If anyone smokes, please quit smoking. And another most important thing is do not take the over-the-counter pills on a regular basis, especially or people are used to take painkillers rationally for a long time. So do not use painkillers unless supervised by a qualified doctor. And get your kidney function checked at least once in a year if you are having a high risk factors for CKD like diabetes, hypertension, old age more than 60 years, obesity, and any history of kidney disease like stones or cysts in the kidneys, or any family history of kidney disease. Thank you.